The sensitization should be rigid. It should be, spread even to the villages. Are there efforts at bringing this before the people, those who actually would want to prepare meats such as that, animals, to let them in on what exactly is happening?
Yes, we are doing that. But then it is worth reiterating that right now there is no indigenous case of this disease in Nigeria. We need to warn people, but it is not in Nigeria. The only case we had was an imported case where it is happening. So there is that distinction. If we have an indigenous case, then we will be afraid that, okay, we do have something in the environment that is transmitting it. But like you rightly said, what we are doing basically is involving contiguous states in Nigeria to this regular meetings that we have. We share information with them about what we're trying to do in Lagos, and this can be replicated all over.
All right, that takes me to this comment from Deroju. He says, hi guys, everyone is talking about controls and checks at the airport, but no one is talking about controls and checks at the land ports. People travel by road to other West African countries, and then he asks, what is being done at the land ports and people coming in by buses?
I can assure Deroju that that has already been done. It's one of the first things that the Port Health Authority did. They actually are monitoring both land, sea, and air ports to Nigeria. And we get regular reports from the people, especially at Seme border, about the number of buses they have interceded in and what they have done. And as of now, there's been no report of any suspicious case.
Okay, Otu from Wari says, can the virus be detected before the critical stage? He says, if yes, why did the hospital not detect it before Monday when it got to the critical stage?
The virus cannot be detected before the critical stage. We need to keep on re-emphasizing this. You have to be ill for the virus to be out. Unfortunately, the initial symptoms are, like I said, of any normal infectious disease. This person came in with anti-malaria drugs from Liberia. And the first suspicion of what is wrong with you is to try and treat for malaria. They took blood samples. But by the second day, somebody noticed something that was awry, that was not in picture with a normal infectious disease, and kickstart the process. So it takes a high degree of clinical knowledge to be able to start the process. And within 4 or 5 hours of actually kickstarting this process, we had an initial confirmation that this is an Ebola case. We confirmed this at the genomics laboratory at the Redeemers University. And so these two confirmatory tests really told us, and before that time, because of the high index of suspicion, first consultant had started doing barrier nursing. So it is not something, that's the part of it that is a little bit difficult. You cannot detect if the patient is not ill.
I go back to the issue of education. I talked about awareness program, which we're doing here, and I wanted us to see if we can take it further to people who don't have access to some of the basics of communication, television, radio, and see if we can speak to them. Though you say, yes, we haven't had an indigenous outbreak yet or case yet. What about those who come in through our borders? We have border towns. We have security agencies that should also keep watch over our airports and entry points. Are these people being brought on this particular case so that they have an idea of what exactly they should look out for?
Yes, this has been done. I can assure you that one. The federal government has basically alerted all border posts that are in the country, both known and unknown, to try and make sure that there is a certain degree of caution for people coming in. we've distributed as many thermometers as we can. We intend to try and get an infrared thermal scan in which you walk through and it detects if you have a high temperature, and from there we can go on doing that. So, but it's all
really
about
imperative we'll get that.
what
The infrared.
thermal
yeah,
scan. Yes, it's imperative we will get that.
And the hospital, how soon is it likely to be open? Because we understand it's not a permanent closure. You have closed it for some time. You have tried to, is it disinfect or decontaminate whatever you can in that hospital? How long does that take? Is it for a number of days or months?
It will be in a number of days. We've started, first of all, with what we call the hot area, which is the floor that this index case was admitted in. And we'll do that gradually. Everybody, still yesterday evening, another floor was decontaminated. We need to do it in a steady, purposeful manner. And once we do that, with the experts, because we've had people coming in from all over the world, UNICEF, World Health Organization, CDC, and people who have had practical experience in managing this outbreak in West Africa. They're around with us and they are advising about what to do. Once we're able to finish all this decontamination, we will sit down and we'll take a decision exactly when it will be open. I can assure that it will be, it's not going to be in a matter of months, it's going to be in a matter of days, but exactly when, I cannot give you an answer right now.
Well, Jerry wants to know, he's worried about cows and chicken. Any chance they can be contracted from those?
I don't think so. That I don't know of any, as is in literature, that says cows and chickens are sources of.
Okay, but the good thing is, I mean, we also have the capacity to analyze all of this
yes,
here.
at least
in
we have two laboratories. One in the medical college in Lagos, Louth, and the other one at Rimas University, just round the corner here.
Now, I understand that you're also appealing to traditional health practitioners. Look, if you see any suspicious case, you have to report it. Are you getting any, how successful are you with those messages, getting across to them?
We are getting.
Are they responding to them?
Yes, Lagos State has a traditional medicine board, which actually regulates the affairs of traditional medicine practitioners. So we are appealing to them through this board, and the board is monitoring them. And I'm sure we've had some degree of cooperation with them before, so we will be able to do that.
Is the medical association strike affecting anything here?
Not necessarily. Because, you see, if you actually have a case, you won't take it to a normal hospital. You have to take it to an isolation unit. We have preparing, it's almost finished now, an isolation unit at the infectious disease hospital in Yaba. This is part of what we've been doing, so that if we actually have a case, we'll have somewhere where we can put them and quarantine them.
So in the meantime, the coast appears to be clear.
Yes.
Wash your hands, the preventive measures that you talked about.
Yes.
And if they see any suspicious case, those numbers are still very active, are they?
They are still.
Are they 24 hours?
Yeah, they are. One of them is my number, and I keep on getting calls and texts and.
You must sleep at some point in time, don't you?
We try as much as possible. I'm a late sleeper, really, so we try as much as possible to be available at all times to be able to answer questions. But just to go further to that, we intend to actually activate the emergency numbers of Lagos State, which we normally use, which is 767, and people can actually call in and pass on messages to us.
Okay then, so thank you very much indeed. That's where we had to let it go today. We've been speaking with Dr. Oluwakayode Oguntimehin, who is the Permanent Secretary, Primary Healthcare Board in Lagos. He's been talking about the Ebola virus threat. At the moment, there's no threat yet.
Yes.
None.
Yes.
Okay. All right.
No case yet, and we hope to keep it that way, because like I said earlier, it is an illness that burns itself out. If it doesn't have anybody to infect, the outbreak stops.
Okay. Thank you for coming on today. We'll be back after this break. Don't go away.